But with that, let's start for today. And today's more of a Q&A. But I want to talk about some specific things, and I'm going to play a short video. Is anybody out there? You don't have to answer the question. It's rhetorical. But Dr. John Campbell is a Brit, lives in the north of England, and when he first came on, he was getting 5,000 hits, 10,000 hits, and I'm saying to myself, what am I doing wrong? But he's just a humble guy, and sometimes things go viral. But he produces content every day, and he, in my opinion, he's extraordinarily objective. And if you've been watching him over the year and a half, you'll see him sort of trending towards our side, but staying as objective as he possibly can. And I'm going to show you two videos from him. I'll play a short one because the point is, I believe that if you got COVID sometime in the past from a different strain or whatever we're calling them, you can get it in the future. And so I think it's important that everybody be aware of this, because I believe I had it in February of 2020, and it was very mild, and then I got it again in December of 2021, and it was not so mild. And so I think everybody needs to be vigilant. I don't think it's a killer, or it has to be a killer. I think you want natural immunity. That obviously goes with it. I think we all need to be aware of what our immune health status is. Where do you lie on the health disease continuum? We'll be announcing a program for people who have already done labs with us to do a retake and see comparatively where they are. I'll be announcing this probably, sometime this week, as we put that program together and build the reports. But I think there are some very basic things you can do whenever there's a potential for exposure. And we'll talk about that today. I'll have Dr. Carter chime in on what he's doing, because this is very important. And I used to think I knew a fair amount on immunology, and I've learned so much more in the last year, and particularly the last month, in writing a book. And you talk about immune system, you really have to dive deep. And I think a lot has bubbled to the surface since the SARS-CoV-2 and the COVID-19 flu, if you will. So we've learned a lot more about the different phases of immunity. One major phase, which I'll hold tight to the vest for a moment, but you all know it, was largely, I largely ignored that as a very important part. But anyway, let's get an update from Dr. Campbell, and I'll put the link to this video because he does a lot of facts and figures and statistics and all that, which I think is fantastic. But I just want to spend a minute and 20 seconds with him explaining what he sees is coming down the pike that hasn't really hit the U.S. yet. So, there is more exposure coming, even though we think things are waning in terms of severity. And pandemics often burn themselves out in 2 to 3 years. So here's Dr. Campbell. And his site, I just look up Dr. John Campbell. And you can see here he's exploded to 2.2 million subscribers, because he's just, first of all, let's admit he's adorable. So here we go.
Well, a warm welcome to this talk. And we're going to cover some of the new information that's come out for the end of January from the British resources and government on Omicron. Now, wherever you are, it's very likely you're going to be exposed to Omicron in the next few weeks if you haven't been already. It's growing in the United States, it's growing in the United Kingdom, it's growing in Europe, it's growing in Canada. And as we saw, thankfully, the Ugandan doctors were pleased it was growing in Uganda as well. And of course, the BA2 is not a new variant, it's just a derivative of the original Omicron. So we had the original Omicron. And the BA1 kind of went that way on the evolutionary phylogenetic tree on the clade, and the BA2 went that way. So it's not that the BA2 evolved from the BA1. It didn't. They both evolved separately, but they're both Omicron variants and behave as such. And this is what we've been anticipating for some time, but it's always good to have the confirmation of this, because this is going to be everywhere. So when we said everyone's going to be exposed to Omicron, those of us that have been exposed to Omicron BA1 so far, we're also going to be exposed to Omicron BA2, but I'm expecting you're going to have very high levels of immunity against BA2 Omicron and have absolutely minimal symptoms or in all probability no symptoms. Now, I can't confirm that yet, but that's what I strongly suspect, because that's the most common question we're being asked. So if you've had Delta, not much protection against symptomatic Omicron. If you've had vaccinations, not a lot of protection against symptomatic Omicron, to be quite honest, as we'll see. We've got some figures on that. But you are protected against hospitalisation. If you had Omicron, you're going to be protected from Delta. And if you've had Omicron BA1, it's looking likely that you're going to be protected from Omicron BA2, but I can't guarantee that yet. But that's what we think. Now, I'm just going to run.
Here is another video from Dr. Campbell on immunology. And it is an hour long, but at the beginning, and I don't know who Robert Clancy is, but oops, we muted these gentlemen. Let's find out.
Just delighted to introduce Emeritus Professor Robert Clancy from Sydney, Australia. That's right, isn't it? You're in Sydney at the moment.
I'm in Sydney, yes.
Yeah, that's right, yeah, nice and warm, yeah. Clinical immunologist, in fact, pioneering clinical immunologist. I believe you were one of the first. Well, were you the first senior clinical immunologist in Australia?
Well, there was no training program when I started, so 2 or 3 of us got together and said, look, let's make it something.
Right,
yeah,
okay.
So we were. That was at a time when the British were very laboratory orientated. You might remember with people like Ivan Lloyd, long time ago.
Yeah, but so you actually started doing it clinically. You're obviously a medical doctor.
Correct.
You've specialised in infections of the airway and the gut. And what I'd never heard of until I started preparing for this is the gut-lung axis, which I'd love to talk about later. You've developed a new vaccine in the mid-'80s, was it, for acute bronchitis vaccine?
That's correct, yes.
Yep. You're a physician and a pathologist. How you managed to do that in one lifetime amuses me, but it's amazing. You're a medical researcher. I did check 260 publications.
Is that right?
That is a lot more than me. Let's just leave it at that. Nearly 6,000 citations, which is amazing. Foundation chair in the University of Newcastle. That's obviously the one in Australia in pathology.
So I won't go any further than this, but what he talks about is the mucosal system, the barrier system. And I know or most people are aware of the barrier, and I'll have Dr. Carter weigh in right now. Michael, what are you doing with patients to safeguard the barrier? Because I know I've been suggesting certain things, but I think the FLCCC has their protocol for it. But in terms of nasal, lungs, esophagus, gut, Michael, what are you doing for folks when it comes to that area?
Well, I mean, yeah, they have, some other protocols using, the iodine spray, which has shown to be quite beneficial. My preference is using the combination of the Biocide and throat spray, because that is clinically shown to increase secretory IgA levels, so the main immunoglobulin, your gut, but that extends all the way to all mucosa. So doing 3 sprays of that a day prior to, going to work or going out and so forth enhances things, using the Argentin 23, which is a silver hydrosol. They also have it as a nasal sprayer. And
Can you put it in the chat, please?
What I'm going to do is I will endeavor to publish this sooner than later. I'll probably try to get it out by Wednesday, so you can watch. If you subscribe to our YouTube channel or just go to our website, there's a YouTube button and you'll be able to get right to our video. So this will be published.
The Argentin 23, which is a silver hydrosol, which also broad spectrum anti-pathogenic for all types of bugs and so forth. Extremely beneficial. And of course, what I'm, finding more commonly with my long COVID patients is that they are noting that, their PCR tests or what have you is negative, but the virus is replicating in the gut. So on my protocol, because I have a very extensive protocol that I send out to my patients, it talks about, these are the baseline supplements that you should be on. I mean, it's a huge list, mind you, but again, I try to target it for the patient, but, I have the baseline protocol, the protocol if you get symptoms, how to ramp up on the different supplements, what else to add to that. And, but getting back to the gut, the vast majority of people have leaky gut. So, and in turn, most people have a decrease in immune strength in their guts. So again, remember 70 to 80% of your immune system is in your gut. So I strongly advise people to be gluten-free, be dairy-free, non-GMO, no sugar, eat as healthy as you possibly can while you are symptomatic, especially. But, if you can, do that along the whole pathway. I mean, the studies have shown those people who are more plant-based have a much, much lower incidence of getting COVID and having, symptoms. And not necessarily that I'm saying everyone needs to be plant-based. I'm not plant-based. I do eat a lot of vegetables, but again, I'm still a meat eater. But yes, using the supplements that help rebuild the lining of the gut, and also using immunoglobulin supplements that help to bolster that arena, and then using good probiotics. I like the Megaspore, I like the Bravo. So those are, a lot of the things that people really, really just need to look at. And I will tell you what I'm also finding, that people are assuming that they have a cold or flu. These days, I can't tell you how many patients that are coming to me 3, 4, 5, 10 days into it, and they are so behind the 8 ball, and they really have no idea where their saturations are. A lot of them never even bought a pulse oximeter. That's something that everyone has to have in their arsenal. Several people call me and, they get one and it's like, oh my God, my saturation is 75%, and they have no clue at all. So, that of course is indicative of significant problems with lung oxygenation. Your lab values will be through the roof because I've tested numerous patients. Your inflammatory markers crazy high, and of course D-dimer levels. And having high D-dimer levels is problematic because you can get blood clots, you can get a pulmonary embolus. So in some of those situations, I insist that they go in to get a CT scan to make sure that they are not having a blood clot to the lungs, because that can be deadly. So people really, really need to be prepared before the onset, because this is not going to stop. And yeah, all right. So yes, Omicron is the according to the powers that be, the dominant variant. But over this last month or so, I've had at least 20 patients, and of course I don't know what the variant is, but they're pretty sick. Now I've been able to keep them out of the hospital, and some of them I've actually had to send to get IV treatment, IV vitamin C, IV glutathione, IV ozone, all of these things, because they were headed in the wrong direction. So, but that can get a bit pricey, I mean, a really robust IV vitamin regimen is about $450 per IV. and you need those about 3 times a week. And a couple of the patients, they've been there 3 weeks doing this, but it's gotten them out of the woods, but significant investment. So you really want to have all the other things because, the ivermectin and hydroxychloroquine do not work alone. And that's another thing that I think that people are kind of banking on, and they're surprised when it doesn't work, or as well as they feel that it should work. So that's another thing that I help to educate people on, that there are a whole lot of other things that you need to be on and you need to take into account.
Thank you, Michael. So,
Yep.
So the gut, and you forced me off of my dairy and gluten.
Yep.
Yesterday I bought gluten-free pie crust. I should make my own with almond flour, but I don't. Too lazy. But Michael, so the nasal cavity, iodine, I'm using a Sinupulse and flowing it through my nasal cavity. There's sprays.
Mm-hmm.
What you think in this environment, everybody should get something like an Neti Pot or a Sinupulse?
It all can be quite beneficial. Absolutely.
Yeah, and so it's $100 investment. And I think the nasal cavity, when I traveled, I went completely unprepared to Texas. And so I didn't have any opportunity to mitigate the replication of the virus. So the dose makes the poison. So if it's in the nasal cavity, somewhat latent, and I think latent is sort of a misnomer, it's replicating. You go from 1 to 2 to 4 to 8 to 16 to 32. Not significant. 64, 128, 256, and before you know it, you're at 100 million. 30.
One point about that, from now what I'm hearing from the experts out there, that once you get the virus, after about 5 days or so, it has stopped replicating. So again, day 6, 7, and beyond, the negative symptoms that you're having are because of the cytokine storm in one iteration or another. So that's again where all of these other things come into play, and of course the higher incidence of getting blood clots and so forth.
This is a Q&A day on COVID. Oh.
So that's really, really important to note. And that's, of course, generally why hydroxychloroquine really only has a very small window of opportunity to be effective, and obviously in conjunction with zinc, because ACQ doesn't work by itself. Again, if you don't have adequate levels of zinc, and zinc helps to stop the replication of the virus. But again, if you're past day 5, you're not worried so much about the replication phase of it.
Interesting. And in those circumstances, then you're doing some type of steroid or?
Yep, I put budesonide, which is the inhaled steroid. Obviously, if they have decreased saturations, I'll do a Z-Pak, which is the antibiotic. And of course, the 3% hydrogen peroxide can be quite magical. I mean, everyone that I put that on has responded positively to that. But again, it's not just that by itself. You have to bolster the D, the C, the selenium, the quercetin, the N-acetylcysteine, which is obviously much more difficult to come by now. I mean, we're still fortunate that that's in short supply in the full script. But generally speaking, you really can't find N-acetylcysteine because the FDA is trying to take it off the market.
Good. There's a doctors having a meeting.
So those are a whole host of things that people need to be aware of. So, like I said, in my regimen, I have it pretty dialed in as to what you should be taking. I have probably about 45 different things on there. And it really kind of depends on where you are on the disease continuum. And of course, I've been able to get a lot of people to do their labs, and they're always very shocked at what it looks like, especially their inflammatory markers and their vitamin D level. I have a handful of people who actually have adequate levels of vitamin D. But again, vitamin D alone is still not it. So if you have high fibrinogen and high ferritin, which is very, very common, and, when Dr. Lewis and I did our talk with Dr. Mercola, we were talking about some of the underlying things, especially the underlying pathogens. Of course, doing our short panel is not going to tell you what kind of pathogens you have. However, looking at the CBC and the neutrophil to lymphocyte ratio and the individual neutrophils and lymphocytes and all of that will infer, bacterial load or a viral load or a parasitic load, looking at eosinophils that can drag you down. And because that's another thing that contributes to long COVID. If you have Epstein-Barr virus and herpes virus, parvovirus and Lyme disease and mycoplasma and all sorts of things, which a lot of you have, then that one other, virus comes along and you're wondering why you can't get over this. Well, it's because your body is fighting on 5 or 6 different other fronts, fighting other pathogens. And then you couple that with nutrient deficiencies. And then you couple that with the standard American diet. And then you couple that with high, loads of mercury or aluminum. And the list goes on and on. So that's why everybody is experiencing different results from this.
That have come in, questions and comments, and have Dr. Carter comment on any or all of these. But Doris said, I know a few that had COVID 3 times, and 2 of them are vaccinated and boosted. So, not uncommon, Michael?
Say it again.
I know a few that had COVID 3 times.
Yes.
And 2 of them are vaccinated and boosted.
Oh, yeah, well, absolutely. Like I said, every week now I'm getting several people who have had the vaccine and boosted and are getting COVID and are having very, very significant symptoms. And like the other thing I said, I've had at least one a week where a family member just yesterday told me that their husband, was vaccinated and boosted and got COVID, went to the hospital, and 2 weeks later he was dead.
Ugly. I am just pulling up another video now because Dr. Carter talked about our analytics, and I think it's important to understand what, and I'm writing this chapter right now.
Sometimes the best do-it-yourself skincare solutions are also the easiest. Personally, I'm a big fan of
grab the video, but the advertisements are relentless. Anyway, this is the talk we gave at the Silicon Valley Health Forum, and it's definitely the longest. It's a long talk on proper. I'm just writing it, proper lab testing and evaluation. And the thesis of the book we're writing is about surviving pandemics, but it's also about health freedom. And what we're talking about, what the chapter I'm writing now, is how politics have significantly restricted the quality of the lab testing that you are getting when you go to your traditional doctor. When you look at technology and the explosion of technology and information, and you look at almost every other technological silo, rocketry, air travel, automobiles, the silicon chip, there's a clear correlation between human knowledge expansion and the improvement in these technologies. Medicine is the only one that's going backwards. Chronic diseases are going up like this. if we were seeing this kind of informational explosion translating into healthcare, chronic diseases would be going down like this rather than up. So we know it's a political issue. So what Dr. Carter and I are advocating is really the first phase of any appreciation for risk is the subjective, doing the survey, finding out what your complaints are and sort of lifestyle and behaviors, determinants of health. But proper evaluation of labs is absolutely, absolutely critical. Is it everything? Do people with good labs still get pretty severe disease? Absolutely. The Delta variant was pretty tough. I look healthy, but I wouldn't say I was perfectly healthy. I have a bunch of stuff going on that I found out by running my own labs. It's the apparently well. That's the problem we have. Why would the chairman and CEO of Kaiser Permanente die suddenly of a heart attack? Why would John Warner, president of the American Heart Association, 58 years old, nearly die of a heart attack? It's these latencies, and the subacute infection is particularly important. The number one place is the mouth, the root canals. Michael, I'll just answer some questions now. But anyway, I put that in the chat. It's a long one. Andrew will definitely watch it. I know Judy will watch it, right, Judy? But anyway, why do so many get headaches with the virus?
Oh, because it's an inflammatory process going on. It's actually activating your microglial cells, which are basically the immune sentries in the brain. And of course, the spike protein is the problem, whether it's coming from the virus itself or from the vaccine. And that causes an inflammatory process pretty much everywhere. So the brain is very vulnerable to that. So very, very common symptom.
Hold up your two thumbs about the size of your carotid arteries. The brain is extremely vascular. That means it's like a Hummer compared to a Prius. It's using a lot of fuel. Okay, so you start cutting off that fuel supply, and this virus attacks the blood, the vessels, perforates the end of the glycocalyx, impedes blood flow. You see all kinds of, the body, in my case, my ferritin went sky high and my iron went down. Okay, that's blood supply. Why to do that? It's called anemia of chronic disease, where your brain knows that iron will help catalyze the growth of the virus. So it leaves you with the minimal amount of iron you need to keep chugging along, and the rest of it's tossing into storage as ferritin. So the brain is being very vascular, it's going to affect it. And the eyes are part of the whole headache syndrome, and the cord underneath the retina is extremely vascular as well. Wow, we have a lot of recommendations. Are there any studies confirming shedding of spike protein from vaccinated people to unvaccinated?
I think that's just ongoing. I mean, again, there's a lot of speculation that it's shed in exosomes. So it's, again, I think ultimately all of us are going to be in contact with someone who is shedding and so forth. So, but it still just goes back to, boosting your immune system so you can dampen the effects of it. But yes, there are lots of reports, especially in women, with these menstrual irregularities. Pretty interesting what's happening out there.
Right. Any suggestions for memory issues that may be due to long COVID? That's a great question.
Again, it has to do with looking at optimizing everything. There was something interesting from an anti-inflammatory standpoint that we want to kind of dampen that effect. But again, we kind of have to look at the subacute infectious load on our bodies. And again, the inflammatory markers. If your homocysteine is high, or high sensitivity C-reactive protein is high, that's directly toxic to your blood vessels, which of course is going to lead to brain compromise as well. But what else is on top of that? Again, there's nutrient deficiencies, heavy metals. Do you have a mouthful of amalgams? Do you have, silver fillings that 50% is mercury? And then that is influencing it. So there's no one thing, again, that's going to address that. There are, lots of supplements, the Neo40 and the Uracil, nattokinase that can enhance nutrient blood flow, magnesium, all of those things can be.
Don't forget our cod liver oil, Michael.
Oh, and absolutely cod liver oil, because that's just broad spectrum, anti-inflammatory. But there's just a whole host of things. So it has to be individualized.
See, the brain is very tricky for a couple reasons.
No, absolutely.
Yeah, the blood-brain barrier. So the blood flow, that's why probably the endocalyx, now they're calling it endocalyx pro, is extremely important because of tremendous capillary density in the brain. But also, this article here by a couple of Australian researchers that spent 25, 30 years developing this paper. And what they say is that there's a persistent cytokine storm in the ill brain. And what comes first, chicken or the egg? But the point is, if you have brain fog from COVID, it's going to take a lot longer for the brain to recover than maybe other tissues based on these studies. Think about a concussion. It's a one-time event, yet some people can be affected by that for weeks, months, or even years. So it's this persistent cytokine storm in the brain. So don't give up hope on your brain recovering. It may just take a long time, and you need to throw everything you can anti-inflammatory at it. So what I recommend is, obviously everything Dr. Carter talked about, then maybe you go short-term keto. I don't think keto is a long-term thing because you lose a lot of, if you're not taking in fiber for your gut, that's a problem. The oils, the black seed oil, the hemp oil, throw every oil you can into your system because they're largely anti-inflammatory, assuming you're dealing with something that's more of the omega-6 bent. There have been rare but cases of people that have been comatose after an accident that high dose fish oil, and preferably cod liver oil, has reduced the inflammation enough that they come out of this. So if you're having brain fog, it's not a casual repair. You've got to focus on anti-inflammatory, because I think, and Toxoplasma gondii, Chlamydia pneumoniae, oral pathogens, all can have preloaded your brain, like Dr. Carter said, with that inflammation. So it's really important. This next one, transitioning, is a really great question. Is fasting a good or bad idea when you're struggling with COVID symptoms?
Oh, absolutely. Still, intermittent fasting is great to help increase autophagy, of the bad cells and so forth. I wouldn't necessarily, fast for 3 to 7 days because you still want good nutrition, but again, your nutrition should be really focused on high density, non-GMO, organic, vegetables preferably, some of the fruits like the berries, that are low glycemic because of the flavonoids in them, blueberries, blackberries, raspberries. Those are quite beneficial. Things like spinach and kale and beets, all extremely, extremely beneficial. So juicing, or smoothie would be quite good during these times because, I have a lot of patients who just have no appetite, and they're almost kind of forced to their own fasting, but they are very, very catabolic. They're just losing weight like crazy, because the body is trying to heal itself. But, I wouldn't do any prolonged type of fasting. The intermittent fasting, fine, where you're not consuming anything for 12 to 16 hours and you restrict it. But again, the food that you intake is really, really critical.
Yeah, and so I have up here a private website on the Healthy Bible Partners webpage, and I put the link in there, and it's several videos from different experts around the country and beyond on nutrient density. So when we talk about nutrients, we're not talking about carbs, proteins, and fats. We're talking about the micronutrients. So organ meats are at the top of the list. Cod liver oil is the organ fats from fish, herbs and spices, nuts and seeds, cacao. Then nutrient density drops off dramatically after that because muscle meat doesn't have high density of nutrients. Celery has nutrients in it, but it doesn't have high density. It's more carb and non-digestible carb than it is nutrients when you look at the structure. So when you're sick, you need to bring out the ABMs, the anti-ballistic missiles, the nukes, whatever. And so nutrient density plays a very important role. So I encourage you to look at the work of Dr. Matt Lalonde on our page, who really is a world's expert at objectively measuring nutrient density. I mean, I don't completely agree with his score. For example, eggs are a bit down the list, and I look at egg as sort of like a seed. Yeah, eggs are full of nutrients, so that's
you wouldn't have thought pork would be above vegetables, would have you?
Well, I mean, if it's appropriately fed, Andrew, literally how it works is this: the soil, the plant accumulates, the animal eats the plant, and then we eat the muscle meat. But some muscle meat is going to have decent amount of nutrients, but when you look at it, it's not spectacularly different. And I don't know what his scale is all about. I haven't watched his video in a while. But the point is, it's micronutrients. It's where are the micronutrients. So someone says, if one has high viral load, do eggs feed the viruses? You got to feed your immune system. Your immune system is number one. So I don't think eggs feed the virus. I think eggs feed you.
In general, as long as you're not, sensitive to eggs. And of course, if you are a follower of, I'm blanking on his name, but he wrote the celery book. Well, a lot of different books.
Anthony Williams.
There you go. Yeah. So he definitely states that eggs can be quite problematic in the genesis of Epstein-Barr virus and others. So whether you believe that or not, but again, doing a food sensitivity test and a highly accurate one can tell you. I mean, more like the Vibrant America, where you're doing things at the peptide level, would really kind of tell you if, in fact, that's problematic.
Yeah, and
thank you. That's good.
The question is on oils, the essential oils that are rich in micronutrients. I'm getting the book from these folks, and I'll read a little bit more about that. But apparently, they're very concentrated but I'm not sure how broad they are in terms of things that they provide. Ongoing learning on my part. Brain fog when I eliminated grains, did a mitochondrial AIP diet, magic. What would AIP be?
Autoimmune paleo.
Oh, of course. So I put the link to our nutrients. Yeah, I'm just going backwards now. How do you spell those supplement recommendations you mentioned for the brain, please? You're gonna have to listen to the video because we talked about a bunch of different things now. But I'll spell out one: cod liver oil. Start on that at 15 grams a day, which is half a shot glass. Shoot it on a full stomach after dinner every day.
Yeah, absolutely.
So that's an easy one.
Liposomal curcumin, also very beneficial. And now, of course, we're finding, there's studies on the CBD, but again, every brand is not created equal. But there's some really good research on, especially the full spectrum CBD that has the entourage effect with the terpenes and so forth.
So how do you treat loss of taste or smell? Is that just
generally that's coming from a zinc deficiency? However, it can be more advanced because of actual destruction stunting those nerves, right? But zinc is critical in the genesis of smell and taste. So that's the first thing that you want to replace, but not being too aggressive, because taking too much zinc above 50 milligrams a day for long periods of time, generally speaking, in my protocol, I'll have someone do 150 milligrams of zinc for 5 to 7 days, but generally no more than that, because long-term, zinc will deplete your copper levels. And then that's actually more detrimental because that affects your immune system. But kind of following a micronutrient test would be beneficial, because then that would tell you when your cells, red blood cells and your white blood cells, are sufficiently full of zinc. Otherwise, it's this, using things that are the anti-inflammatory things and promoting the neurogenesis, so that's really important.
Amy, thank you. Dr. Harvey Risch from Yale gave a Q&A for Connecticut residents. He claims that natural immunity was effective up to the Delta variant. After that, reinfection may occur. That's why we're having this conversation today. It's like, be prepared. Watch that second video I posted by Campbell on immunology, but re-listen to this or go to FLCCC on mucosal maintenance. I think that's really, really critical to catch it early on. Let's see, does Dr. McCullough have info on the mass vaccination driving the variants? I've seen that before, and I'll have to research that.
No, that comes from several, other individuals, Dr. Bhakti and Michael Yeadon and others, who've warned that it puts pressure on the virus because, again, kind of think of it like antibiotic resistance. You get all of these antibiotics for things that don't require antibiotics, and then you end up with MRSA, methicillin-resistant Staph aureus or other resistant bugs. Well, the same thing, if you're doing a mass vaccination type program, then the virus wants to live, so it will mutate. Now, is it going to be beyond the Omicron? I personally think so. Hopefully not. Hopefully we're in a lull here, and then things will kind of peter out. But who knows? Who knows? So it still then goes back to the strength of your own immune system, and again, going back to emptying your bucket. Remember, everyone has a different level of their own individual bucket and what's making it full. So the less full that bucket is of the various things that we've talked about, the more resilient that you're going to be.
Thank you, Michael. I'm just, for anybody who hasn't had our testing, I'm putting a link to our Empty Your Bucket program. So it's out there. What else do we have for questions? I started at the bottom and working my way up, but let's go down.
While again, I implore everyone to read the book, The Real Anthony Fauci. That will really crystallize in everyone's mind what has been going on for years, and it's just pretty much a rehash of the same, plan, so to speak. And the same thing happening with previous vaccines that is happening with this one, with the antibody-dependent enhancement, with the swine flu, with the dengue vaccine, with the RSV vaccine. The list goes on. I mean, it's incredible when it's all laid out for you. And Robert Kennedy did a masterful job of really doing the whole timeline. And it's just extraordinary. Absolutely extraordinary.
And by the way, you can get the PDF for free.
Yeah.
Tell us how.
Let me go. I'll find the link and post it. Hang on just a sec.
Thank you, Steve.
I'll post it.
Someone asked, is it acceptable to use Biocide and TS in one's nose?
I'm sure that's not a problem. It may burn a little bit. That's why I personally haven't used it there, but I don't see why you can't. I would prefer the Argentin 23, which is the silver hydrosol, which is totally, non-inflammatory, but accomplishes this. Well, it accomplishes the same thing in terms of pathogen killing. The other benefit with the Biocide and throat spray, it kills pathogens, but it also increases the strength of your immunoglobulin A, which that's not a part of necessarily what the Argentin 23 does. So it's a great combo to use together.
Michael, can you comment on the various levels of oxygen saturation and how one should respond to those levels if there's some sort of guidance?
Well, I mean, normal oxygen saturation is, somewhere around 97 to 100%. So once it starts falling, then you need to be concerned. Definitely once it gets below 90%, there's some major issues going on. And do you actually need to be placed on oxygen? It really kind of depends on your, the other diseases and so forth that you have underlying, especially, let's say, you have COPD, where you are generally on, the, more challenging end, shall we say, of getting good oxygenation and so forth. Being a smoker and all of these different things. But on top of that, if you have a pneumonia, like a real pneumonia, bacterial pneumonia brewing, that can be problematic. So, but yes, you need to be concerned, but being aggressive at all these other things, having them on hand, the 3% food grade hydrogen peroxide, the breakdown products of that is oxygen and water. So every time when someone nebulizes with that, they see their oxygen saturation go up. So that's incredibly beneficial, doing that 3, 4, or more times a day. But it doesn't necessarily stay up again. So if you really have a pneumonia going on, bacterial pneumonia, then obviously the antibiotics are going to be critical with that. Budesonide, which I prescribe, then Hale steroid, because then that is anti-inflammatory directly to the lungs. Of course, a lot of doctors are, doing oral prednisone, which may have some effect. And I'm not saying it's not, effective at all. But of course, having that steroid going directly into the lungs is way more beneficial.
I'm gonna make one comment, and then we're gonna end for today on the prophylactic ivermectin. And I'll let Dr. Carter weigh in. I largely disagree with the FLCCC's recommendation of once or twice a week, because pharmacologically, a drug company will spend $5-10 billion to develop a drug, and a lot of that has to do with safety, which isn't happening with a vaccine, by the way, obviously, and a lot of it has to do with dosing. Dose makes the poison, the dose makes the cure. On the spectrum of dose, if it's too low, it does nothing. And then as we work our way up, we get potentially a benefit, and then there can be toxicity. Everything has toxicity at too high a dose, everything. Vitamin C might be the most safe thing, more than water. All you do is get bowel intolerance, but everything has sort of a therapeutic and toxic dose, particularly in the drug realm. So I actually think taking ivermectin once or twice a week and think you're protected is probably not adequate, because your pharmacokinetics, your dose, your blood level of that drug is probably below a real therapeutic thing. I had someone this morning that had an issue, and they were put on a Z-Pack or other, can't remember exactly which one, and they only gave them a half a dose in terms of like 4 or 5 days, and then it came back even stronger. You've got to go to the finish line. So my recommendation, which may not be perfect either, is you go full dose for 5 days prophylactically, and then you take a little break. We call it pulsing, but at least during that period you're getting a full, consistent dose of the medication. So you might go 5 days on, 3 weeks off, 5 days on, something like that. Obviously, if you feel you've gotten a significant exposure, clean the mucosals, but then I'd pulse for 5 days. I wouldn't just do, Monday, Thursday. That pharmacologically, you're going to drop way off, and it's probably not going to be effective. Michael, any comment on that?
Yeah, of course, there are a lot of different protocols. The latest one where they said from a cumulative dose, I believe is somewhere between 240 and 260 milligrams. Once you get to that dose, then you can kind of take a break. But again, there are several people who've been on the preventative dose, and they still get COVID. I personally have not been on a preventative dose because it is a bit more.
Oops.
Right, and I only use it. I've used it on family members who've gotten COVID. I personally, knock on wood, have still been fine. But again, with the supplement regimen that I'm on, I feel pretty confident that I'm pretty resilient. Not to say that it's not going to happen, but in this whole time frame, I have not used a preventative dose.
Interesting. And with that, next week, we're going to learn from Dr. Mitch in New York all about sleep, and he has a book on sleep, and I think it's a big issue, and I'm excited to hear about it because my sleep hygiene is horrendous, and I need to be kicked upside the head and improve it.
One of the major immunity is good sleep, and probably one of the reasons so many people are getting, second and third hits of COVID, probably because of their lack of sleep.
Absolutely.
Well, I think lack of rest, stress, and lack of sleep contributed to me. No question about it.
What's the name of the book?
Well, Doris, I know you're going to be here next week. So I don't want to get.
But I want to read it now.
I don't want to go down that rabbit.
Yes, we can't wait.
I don't want to go down that rabbit hole. Otherwise, I'm going to miss lunch, and I have a nice piece of Scottish salmon waiting for me.
Okay, I'll do my skip
Mitch, you and I
tracing.
will chat, but you really don't have to. I'll send you the link. Fire away. You know the format, and I can't wait to hear from you.
I have a quick request, Dr. Carter. Someday, can you reveal to us your supplement regimen? And I know it'd be different for every person, but it'd be great to know what you're taking.
It should be posted on our website in our store.
We have also have a blog on that.
Okay. All right, thank you.
So, but I'll check with Michael and make sure it's updated, and make sure we have everything in it. Okay?
You see, we know you healed because you're hungry and you want to go eat lunch.
Stop. As they say in Massachusetts, I'm starving.
Oh, God.
Bye, all.
Thank you very much, doctors.
Thank
Bye
you.
now.
Good day. Good day.
Good day.
Thank you.
Lovely doctors. Thank you.